Welcome to Family Life with Mama Rita. I miss you and I hope you miss me too. Convention of Saints was powerful. And that is why I decided I'm still swimming in the grace and the anointing and the beauty of Convention of Saints. So I decided to move my studio and use Convention of Saints studio. So if you see Convention of Saints behind me, it's on purpose. I still am receiving my miracles, my testimonies, and my breakthroughs. I don't know about you, but convention this year, Convention 2024, was powerful. Convention 2024, me, myself, my soul was happy. I spotted and made my soul happy. And all the people, all my daughters and my sons who sent me messages telling me I was looking beautiful, please, I received it. And thank you so much. If you haven't started receiving your testimonies, please relax, because your testimony is certainly coming. And I want to give a big shout to all our speakers. To Bishop Alote, we say, God bless you, you were powerful. To Reverend Yani, South Africa, you were powerful. To Reverend Hemeku, oh my God, this year all our speakers were on point. To Reverend Steve Menson, thank you and thank you and thank you. Thank you to all of you, and to our Apostle General for putting this together. We say, may the Lord bless you, may thousandfold.
Amen.
And for everybody that streamlined with us, Convention of Saints 2024. If you haven't received your miracle yet, if you haven't received your testimony yet, get ready, because it's coming big, big, big. I have started collecting mine. And Sunday service, oh, last Sunday was something else. Apostle General was in his elements, teaching us about Thanksgiving, teaching us about bringing our sacrifice of Thanksgiving. That in everything we do, we must start with Thanksgiving, and once we start with Thanksgiving, we will certainly end with Thanksgiving. Why? Because once you give God his Thanksgiving, even before he starts, God wants another Thanksgiving. So he will give you your miracle, so you can thank him again. Last Sunday was so filled and full with gratitude for everything God did during our convention. The first Sunday, the Tuesday night, the Wednesday night, the Thursday night, the Friday night. Hey, I forgot my own son, Reverend Ima Omeda. Thank you for your powerful sermon on Sunday. God bless each one of you. Your sacrifice in the Lord will never Sunday evening. I am still full of miracles, full of testimonies, full of praise, full of thanksgiving. Get ready. We are going to hear lots and lots of testimonies. Well, we haven't forgotten about PINKtober. If you see my board there, I am just reminding you that we are in October. October is PINKtober, Breast Cancer Month. Free breast screening. Please take advantage, be part of it. When it's detected early, your life is saved. I have people who have been on this show to tell us about their stories. Officer at University of Ghana Medical Center called the UGMC Legon. She's with the anesthesia and intensive care units. A member of Royal House medical team. Hey, I don't know who added, but I know who added. It's my co-host who added this one. Wife of Pastor Dr. Elorm Biekro, my own son who has brought me a beautiful daughter, and the mother of one beautiful daughter. Dr. Elorm, you are welcome.
Thank you so much, Mommy. Thank you so much for having me. God bless you. I'm so honored to be here.
I promise, how many years ago? Is it 2-3 years ago?
I think
that
about
I was bringing you to this show. Every year I wanted you. You are either you are pregnant, or you are in the labor ward, or you are taking care of the baby, or you are writing an exam, or for me to get you today, I will make sure I milk you very well. I'll bring all the knowledge out of you.
Yes,
if
Mommy.
my time is up, we will close.
Mommy, I'm
But
happy
we will stay here and today I have 101 questions for you.
Yes, please.
But welcome, welcome, welcome.
Thank you so much.
I am so grateful to have you.
Thank you so much.
The
Mommy.
last time you were with us at our Pink Walk.
Yes, please.
I think 2 years ago.
I think it was about 2 years ago.
2 years ago, you were so brilliant.
Thank you.
So brilliant on your talk on cancer and prevention of breast cancer.
Thank you.
And I am very, very honored to have you here this afternoon.
Thank you, Mommy.
So I am going to start straight away with my questions.
Yes, please.
Breast cancer is the commonest cancer type among women, contributing 30% of all cancer cases. Why is this case? Why is this the case?
So honestly,
Why is it so common?
breast cancer is, I'm actually happy we are talking about breast cancer. We've actually dedicated a whole month to breast cancer because it's one of the cancers that we can easily do something about. It's within our reach. So it's something that we shouldn't let our loved ones depart over.
I like that.
And breast cancer, it's actually said as amongst the cancers that face women, 30% is common. 30%. That's such a high. Even it's actually 31.8%.
Wow.
Yes.
In the month of October, it's not only women who are making noise or celebrating. I won't say we are celebrating breast cancer, but causing awareness. Men must also start. They must check.
Exactly.
Don't wait until something happens before you say, had I known.
Exactly,
So
Mommy.
please tell the men who are watching us that it's not only a woman's thing. It happens to men.
Yes, please. Mommy, honestly, so I just want to tell every man watching this show that, see, breast cancer is real. It doesn't just occur in the female population. It's happening, and even more so now. We are seeing a lot more cases of breast cancer in men as well. Yes, the percentages may be very low in the male population, but men do get breast cancer. And in times past where men will hesitate to come out and show the fact that, or come to the hospitals and present the fact that they have seen something in their breast or are having a certain problem in their breast, now more men, because of awareness, people are coming out, and so we are diagnosing more men having breast cancer. So please, October is not just for the women, it's not just for the ladies, it's for all of us to examine and make sure that we are all fine and we are all safe.
Wow, thank you, Dr. Elorm. So men who are watching men that are listening to us, please, breast cancer is not a woman's thing. Either, I think was it last year or 2 years ago, I had a man who has survived breast cancer coming on this show and telling us his story. My co-host will look for the name for me. Please, men, take advantage. There's no shyness about this. There's no stigma around this. You are just taking good care of yourself and you are walking in wisdom. Please go check. There's no harm in just checking. If you go and everything is fine, praise God. And if you're a man and there's a history of breast cancer in your family, your mother has ever had it, your grandmother has ever had it, an auntie in your family has had it, a sister has had it, please.
Yeah.
Your chances, I wouldn't say your chances of getting, but please go and check and let the doctor say there's nothing wrong with you. It is better than sitting down and it getting worse. Thank you, Dr. Elorm.
Thank you.
So, Dr. Elorm, I want you to tell us what some of the common symptoms of breast cancer.
Okay, so most of the commonest symptom that people usually present with, that we see in the hospitals a lot, is someone coming and saying that they found a certain lump in their breast. That's one of the first symptoms. And I must say that most of the time, this lump is usually painless. And that's why it's so innocuous and it's such a troublesome disease. Because you may be having a lump in your breast, but because there's no pain, and you know pain is a good thing in some ways if you think about it. It alerts you to the fact that there's something going wrong. But because this lump can come and it's usually painless, you might just be living normally and thinking that there's nothing going on until you've actually examined yourself and seen the lump. Okay, but other times you may have breast cancer, but you don't have any lump whatsoever.
Wow.
Yes, mommy. And in that case, usually some people may see some skin changes over the breast. You see that sometimes the skin on your breast begins to look like the orange, the back of the orange with some dimpling around it. So let me make it more better, like the lime or lemon. The way the lemon skin is with the dimpling and all that sometimes can present like that, but you may not have any lump in your breast whatsoever.
So you can have a breast cancer with no lump?
Yes, please. Yes.
Wow.
Some people would even actually not have the skin change. They may not even have a lump, but they'll start seeing that you're not lactating, but you're now having nipple discharge.
Okay.
The nipple discharge may be milky, it may be brownish in color, or it may even come and it's blood stained.
Wow.
Like something pinkish, or it may come as overt blood coming from your nipples. Wow. And that is another indication that you should actually get checked. For other people, the breast may actually be very fine, but they just have some node in their armpits.
Wow.
And that's how it can be. So you may have this small mass in your armpits that you may feel occasionally, but your breast is actually fine. If you have anything like that, just come to the hospital and get it checked.
Wow. Yeah. So how important is early detection?
I mean, early detection makes a big difference in breast cancer diagnosis and breast cancer treatment, because if I should use some statistics to help us all understand very well how much early detection makes a difference. In the US, there was a study that was done, okay, and once you've been detected early enough or you found the lump early enough and we are able to do something about, so the lump is just localized in the breast tissue, you actually have, for your 5-year survival rate, you actually have a 99% chance of survival.
Wow.
But if that cancer has spread to anywhere around the chest, maybe to the other breast or to your armpit or anywhere like that, then now your chance reduces from 99% all the way down to 86%.
Wow.
Then for those who come even later, and it spread maybe to the lung or to the liver, your chance of survival is 36%.
Wow.
So if you compare 36% to 99%, it's a big difference. So if you come early and we're able to catch it early, it makes a world of difference for your treatment.
So Dr. Elorm, tell us, how do we achieve early detection?
Basically, when I started, I was saying that for breast cancer is well within our domain, because you are with your breast at home, okay, and there's so much that you can do that can help in the process of detection of breast cancer. The self-breast examination is one thing that we can't overemphasize. Every month we advocate that every month for a lady, examine your breast. I would tell most of my patients that once you've ended your menses,
okay,
examine your breasts.
Once you end your menses,
it's a sure way to
day after
or 2 days after, but always remember to examine your breast, because I mean, you most once you are not menopausal yet, you would have your menses, and once you have your menses, examine your breast. It's a way to remind us that the last day of my menses, I need to check. If you are menopausal as well or postmenopausal, you can choose any day of the month. So sometimes I'll tell some of the patients that you can choose, even if you were born on the 19th. Decide that every 19th of every month, just so that you can remember.
So every 23rd, I need to check.
Exactly. Wow. So that you can detect it early. Once you feel something that is unusual, you come in and then we check for you. And the other thing to mention is that to be able to know that something is unusual, you should have at least checked in with a doctor for them to tell you that, okay, so this is your normal. Then from then on, when you examine and you feel something unusual, you know that this is unusual and I need to get it checked.
So Dr. Elorm, what you are telling us, though the month of October has been put aside to conscientize us about breast cancer, we don't need to wait till October to start checking.
Exactly.
Every month.
Exactly.
I was born on the 23rd. So the 23rd of every month, I must check.
Exactly.
Or after my period, a day or two after my period, we need to do breast
examination. It's very important.
Wow.
Just pick a day that you can remember and do it.
Wow.
Every month.
I think some people do not even know how to do
the examination.
The examination, you know, the self-examination, they don't know how to do it. So maybe you have to let us know how to do it.
Okay. So for the examination, basically, I would say that look and then feel.
Look and feel. Please repeat. Look and feel. Again. Look and feel. For the last time, look and feel. Okay.
Yes. So you can start off by standing in front of the mirror. Okay. And then once you stand in front of the mirror, just put your hands beside you.
Okay.
And just look at the breast. First and foremost, for your breast, naturally, some people have one breast slightly larger than the other, which is normal. But the difference shouldn't be so overt or so obvious. That most of the time it's not that obvious, but slightly one is larger than the other, and that's normal. But once you look, you are looking to see if one is obviously larger than the other, which is abnormal. Okay, and then you are looking to see if any of the skin changes I've talked about already is present. So once you are observing all those things, then you can also put your hand on your hip. Okay, just press on your hip slightly. As you press on your hip, sometimes the changes that were not there before begin to get more obvious than when your hand was relaxed. Because as you put your hand on your hip, you tense some of the muscles behind the breast, and then the changes that were not there that you couldn't see before become more obvious. So after you do that, you look at the general breast, you look at your nipple as well. If there's no problem, then you can go ahead and then now you start to feel. Okay, so divide your breast into 4 quadrants. Okay, so 4 sections. So once you imagine an imaginary line, one coming downwards and then another across the nipple like that. Okay, so you have this upper inner quadrants, upper outer quadrants, lower outer quadrants, and then the lower inner quadrants. Okay, so you start just to examine, going in that. This is just to make sure that you don't miss any aspect of it. So once you do that, you catch all the different parts and then you feel. When you are done with those 4, you are not done. You have 2 more to go. So you now examine your nipple itself. Okay. So you now press on the nipple, just against the chest wall. When you are done with that, you see your breast goes all the way into your armpits. So you now come to the outer part and then you go like that. And it's important that as you are doing it, you are going in order so that you don't miss any part. For some of us who are very well endowed, the 4 may not be enough, so you may need to do it a little.
6.
Some 6 or 8.
Wow.
Just so that you can cover all the breast tissue. Then once you are done with your armpits as well, then you now come. Just put your breasts together in your hands, okay? And then just slide down slightly. Once you do that and you come to the edge of your, not in a way that's going to be painful, but once you do that and you have any nipple discharge, if it wasn't coming out before, if there's something there, you express it out and then you see it. Then you can look for the color as well. When you are done for this month, but you're not done for every month. Next month, you repeat it again.
Wow. I know some of you are making notes and maybe she was too fast for you. She's going to start all over. How to do self-breast examination. Please get your books, get your notebooks, get your pens or your pencils, or get your iPad, your laptop, or your phone. Please, it will come very handy. Dr. Elorm is going to go over it. Please write it down. Sometimes the mind can be so tricky. You think that you heard everything. Much later, when you were, oh, what did she say? I had 6, I had 4, I had well endowed. Oh, Dr. Elorm, please start for the sake of those who are writing, for the sake of those who are making notes, so that they get it. Please. Please, okay. I know what I'm talking about. Almost every, I don't want to say it, I have people walking into my office crying. Mama Rita, pray for me. I have breast cancer. I'm going through chemo. Please, early detection works, I won't say magic, but works miracles. It's not only deliverance, it's not only prayer. Please. Knowledge is power.
Okay, so basically, I'll say that look, and then feel.
Look and feel.
So stand in front of the mirror, okay?
We are going to the look.
Exactly. Stand in front of the mirror. First, put your hands by your side, and then you are looking at your 2 breasts, okay? Hands by your side, looking at your 2 breasts to see if there's any difference. If there's any difference.
Put your hands by your side in front of your mirror. If you don't have a mirror and you are in Accra, tomorrow go to Mokola, go and get a mirror. Put your hands by your side. Look into the mirror. Look. We are talking about look.
So you look at your breast in front of the mirror. You are trying to see if there's one that is definitely bigger than the other, such that is striking. Okay, naturally people have different sizes, but just look to see if one is way bigger than the other. Once you look at that, you don't have anything like that. Then you are now looking at the skin over both breasts to see if there's any change in color, any change in the texture of the skin. Is it looking like the back of an orange or like the back of the lemon? Anything like that. Once you don't see anything like that, now you can put your hand on your hip. You are still looking, okay? Then the same things that you looked for before, you look at it, look out for them again. Because putting your hand on your hip will make some of the changes more obvious for you. Okay, so don't miss that step as well. Then now, after you are done with the looking, you can now go to the feeling.
The feeling.
Yes.
So you look and you feel.
So for the feeling, you first start by drawing 2 imaginary lines, okay, to divide your breast across your nipple, okay, one vertical and one horizontal, okay. Then so once it's divided, you have an upper inner, upper outer, lower outer, and then a lower inner, okay. So you start and go in order. It doesn't matter where you start from, okay, but you can start from the upper inner. So you start from there and then you gently press on that area very well. Make sure that you've covered all the grounds. And then you go to the upper outer. Feel for that part as well. Then you come to the lower outer. Then you come to the lower inner. quadrants, just to make sure that you have covered every area. And I was saying that some people may have like a lot of breast tissue, so they may have to divide in more than just 4 planes to cover the whole thing. But once you are done, you are not, after the 4, you are not yet done. You examine your nipple as well, just press it down slightly against your chest wall, okay? And then from there, you also go into the parts going into your armpits. You examine all the way into your armpits. If you don't feel any lump, the thing is that you may be clear for this month, but not clear for next month. So next month, you examine again, and you keep going like that.
And some medical practitioners advise that when you are doing the breast examination, you either put oil or soap.
Yes.
I don't know if it makes any difference.
Well, I personally, when we meet patients in the clinic, we don't have access to any of these things.
Okay.
But then again, I don't know if maybe because we've examined over and over again, it's easier to feel. But yes, maybe soap will make it a little more easy to feel. But if that works for you, that's okay. If that doesn't work for you, so you can just do it normally. Once you know that you've been examined before and they've told you that your breast is normal, when you go back home, you examine. Then get used to your normal. So that if anything abnormal shows up, you are able to pick it up.
So it means that PINKtober, you can walk into any hospital.
Exactly.
See a doctor and say, I want to come and do a mammogram.
Exactly.
So do you ask for mammogram or you ask for
ultrasound,
or the doctor determines what you must do?
Usually the doctors will know what you must do. It's standard practice in medicine. So the doctors usually know what you must do. But if they've examined it, they've found something they really think is depending on how it goes, or depending on how dense your breast tissue is. Sometimes you may be over 40, but they'll say that do an ultrasound scan because per their examination, they think a mammogram may miss because of how dense your breast tissue is. Okay, so they would usually, after assessment, be able to tell you that do a mammogram or do an ultrasound scan, or let's do an MRI. But the MRIs are usually, because of how expensive they are usually left for confirming a suspicious lump or something like that.
So I really want to get this right.
Yeah.
You know, in Ghana, we don't have personal doctors.
Yes.
The UK people will say GPs.
Yes.
So in October, can you just walk in? Who do you see? You know, some people are so green about these things.
Yes.
At least in Royal House Chapel, we can walk into our clinic and it's done. But anybody who is listening to us does not even know what to do. What do? Do you walk into the hospital, enter into OPD, or go to the lab, or where do you go? Yeah.
Okay, that's actually a very good question. So in the month of October, most hospitals set up specialized areas where they do the breast cancer screening generally free of charge. Yes, but if you don't have any of those facilities around you, you can walk into any hospital at all. Everybody knows that October has been dedicated to breast cancer. So even if they haven't set up a specialized area where they are doing the screening, they have GPs, like we don't call it GP in Ghana, but they have health practitioners that would see patients on a daily basis. So sort of OPD, random OPD. And then you go there and can ask the doctor that you want to check, because everybody knows breast cancer is Breast Cancer Awareness Month, and every doctor will be happy to help you. So once you go, even if it's not been set up specialized, just feel free and walk into any hospital or find the specialized ones. Like I know Kolebu has set up, UGMC has set up. So you can go to any, I'm not marketing in exactly. So you can go to any of the hospitals close by and then just have it checked.
My darling, when you go and there's a crowd there, don't tell yourself that because there are a lot of people.
Yes.
After October is not free. When you go in November, you pay. You go in December, you pay. You go in January, you pay. But October has been set aside for breast cancer awareness. So please take advantage this October. It doesn't matter the number of people you see there. Exercise patients, all you need is a day.
Yes.
Walk into the hospital, go and see the doctor on duty or the nurse on duty or something, and say that I want to have a breast examination, and anybody will help you. We'll have a commercial break. Please, before we go for the commercial break, every year, Royal Ladies, we set aside the year to do something, you know, do something for humanity, do something, you know, for Mother Ghana, do something. Last 2 years ago, what we did was we did the Mother and Child Project, where we went into maternity homes, we went into the hospitals, mothers who had given birth to babies and they couldn't pay for their medical bills. What we did was we paid for their medical bills so that they could be discharged from the hospital. This year we have taken upon ourselves to take another project, and the project is the Child Cancer Project. I remember 2 years ago, the gentleman that came, please get me his name, said we need to go to the hospital, especially Kolebu Teaching Hospital. There are 3 hospitals in Ghana, only 3 hospitals. Okomfuanochi Hospital in Kumasi, Rage Hospital in Accra, and then Kolebu Teaching Hospital in Accra, where they take care of children who have cancer out of no fault of theirs. We can't say the children were careless or the mothers were careless. No. Why they got it, it can never be explained. So this year what we want to do is to go to Kolebu or Rage and Okomfuanochi and help the child cancer patients. We want to help pay their bills. And we are told, we'll play an advert and you will see that either every month, some of them pay as much as 3,000, others pay as much as, is it a month or a week? We will see it per week. 3,000, 5,000. Where are these mothers or these parents going to get 3,000 and 5,000 per week to help their children recover from cancer? So, Royal Ladies, as part of our 30th anniversary, we want to go to our major hospitals, the Rage Hospital, Kolebu Teaching Hospital, and Okomfuanochi Hospital, to help pay some of the bills. We can't pay all, but help pay some of the bills of these children. We want to see these children recovering from cancer. We want to see these children up and fit on their feet. We want to see these children go back to school. Some of these children can be doctors taking care of other cancer patients. We will go back and play our advert for the Child Cancer Project. Please, what am I saying? Please help us. Help us support these children, innocent children that out of no fault of theirs have cancer today. Please, let's go and watch it. After then, we will go for a commercial break and we'll be back.
Childhood cancers is no fault of the child, and it can happen to any family at all.
And this year also we JHS. But it's say only any treatment in go school. Na yale we ba wa kwan so we busu ya phone feel bi. You see akoja me ne papa pe.
Every year, it's expected that we have about 1,003 children diagnosed with childhood cancer in Ghana. Childhood cancer, number one, is curable. In developed countries, majority of the children, if you take 10 children, 8 out of them receive cure and they live fulfilling lives. But the story is not the same in Ghana, where 4 to 6 children would be saved because of Number one, ignorance of the early warning signs, and number two, the financial constraints associated with treatment of childhood cancer.
Mbeni yelbeze na dakope menyene da na mude obi a wenya code ti mu adechi na mhwe na moje fini hwinuma ore bana mazina ko hospital doctor nkechem do cancer she say why operation first one second one ti doctor is there basan ya kai biom ne medru sha what's the man and every na watch bia muto edru 5000 won fi baby amba.
Treatment of childhood cancer is not easy. Some parents lose their jobs because treatment of cancer can range between 6 months to 2 years in and out of the hospital. And this puts a strain on the family's finances. And it's important that we support children with cancer in every way that we can.
Doctor Bako na refer back nti me ba hanum sane nema ti sika even lab no kra before so be dra be lab to de bia unya sika. Every 3 weeks, I am to almost 3,000. You say, I'm a 1 year in coffee. Say, see, I'm a send me date is only a trade room. No baby, I'm a coffee. Even radiotherapy, I didn't ban a coto soon. 15,500. I started 13 days, you know. And I'm free to say, maintain a face can I maintain. Intimate to us to be. Inti se ama me banu ne ni ba ko pese enkata
Ebia me sister penny ba pe na kada me wo school chanya na me ra ho efise me ye man kame sunu wo school se be pesa man fo be boaye na yenye skane ebi motimi de tomondro.
As part of our 30th anniversary, we are going to make a donation to the pediatric oncology unit. What do we see in the pediatric oncology? Children with cancer. Most of the mothers that come in do not have money to even purchase their medications. Some of the children get diagnosed whilst they are in school or writing exams. Their parents find it very difficult for them to go through all the stages of chemotherapy or even radiotherapy. Some of these children need to have surgery before they have their chemotherapy. And in this situation, when we are working in such a facility and there's no money to help them, donations from the church is what can push or support these kids.
Intimate stress, obi biara or what's my yaw. On trying to measure kolebu, nkole children's blue, and easy my.
The minimum cost of treatment for 6 months for one child costs 10,000 Ghana cedis. Imagine the difference you can make. Join us in this mission. Give what you can. Together, we can make a difference and touch our generation with the power of God.
Welcome back to Family Life with Mama Rita. Well, if you are just joining us, we are celebrating Pink October, Pink Month. If you don't know what Pink Month is about, October, the month of October has been set aside to create awareness for breast cancer. My darling, I don't know how many years now, every October we talk about breast cancer awareness. Please don't sit down. Do something. We are bringing you knowledge. And if I were you, I'll get my notebook and my pen. I'll get my iPad or I'll get my phone. Please write the knowledge down. It will come very handy. Sometimes on the day you want to remember, you realize that, oh, you didn't hear everything. On Sunday, Praising Showers sang a song. I was enjoying the song, only for me to be told that they sang the same song during the convention. My darling, I didn't even hear. I didn't hear. Because where my mind was during the convention, I needed to deal with certain things. I didn't hear them sing that particular song. So you see, sometimes when preaching is being done or talks are being given, you don't hear everything. That is why most often we encourage you, go back, play and listen. Everything Dr. Elorm is teaching will stay. You don't need a cassette. At time you needed to buy a cassette. Reverend Chief Ape used to buy CD. Now you don't buy CD again, you don't buy cassette again. You go back normally on Saturdays, we play on Powerline TV what we showed on Wednesday. You can also go on Facebook, Sam Crunchy. You can go on YouTube and then listen again. So with me today is one of my wonderful daughters, beautiful, intelligent daughters, Dr. Elorm. If you are just joining us, Dr. Elorm is with the University of Ghana Medical Center at Legon here in Accra, UGMC. And Dr. Elorm, you are doing so well. I'm learning a lot today. It's like, oh, I'm listening to this thing, you know, again. Medical experts often talk about risk factors. What do these mean and what are they? What are the risk factors? What do they mean and what are they?
The risk factors of breast cancer, I usually would like to take it as the modifiable and the non-modifiable risk factors. Okay, so simply put, the factors that we can do something about and the ones that we can do nothing about. Okay, so let's first talk about the ones that we can not do anything about. Okay, so some people would have a family history of breast cancer. So most of the times it's in the first degree relative. So like your mother, your sister, your father, your brother. So that's the first degree relative close to you has got breast cancer before. It's something that you can't do anything about. So that alone is a risk factor.
Wow.
And in that, I'll also add the fact that, so mostly for the family history, there's this gene that has been found to be associated with the breast cancer.
Okay.
And this is called the BRCA1 and 2 gene.
Hey, BRCA1
and 2 gene. Okay, so this is what has been found, that there's a when you have a mutation in that gene, so there's a little change in that gene, then you can have breast cancer transferring from family in the family from one generation to another. Okay, it's also associated with other cancers altogether, but in this case we want to focus on the breast cancer. So that goes along with the family history. Also, if someone has had a personal history or a previous history of breast cancer, that alone is another risk factor for which reason you can get breast cancer again.
Wow.
Yes. So those are some of the factors that you can't do anything about. But also another factor that you probably may not be able to do anything about is if you've had your menses very early in life.
Okay.
So before the age of 12. Some girls as low as 8 years, 9 years, they've already had their...
somebody who had it at age 8.
They've already had their menses. And for people who...
it's
a risk factor on its own. Because that means that the person is being exposed to the estrogen for a longer period compared to if I started my menses at 14 or 15. Okay. Then if you've also had your menses ending late in life, so instead of the usual 40, 45, 50 years, you are still having your menses. 55 years, you are still having your menses.
Wow.
That means that you are exposed to estrogen.
I don't even know when mine stopped.
You're exposed to estrogen for a longer period of time. So that alone is another risk factor. That's you can't control. Okay.
Wow.
Then we can talk about the ones that you can do something about. That's like your
So
diet.
I'm coming. The one you can't do anything about.
The non-modifiable.
Non-modifiable.
You can't change it. You can't do anything about it.
Okay, so in the family
history,
the
genetic history that usually runs in the family.
Okay.
Then a personal or previous history of breast cancer.
Okay.
Then the early menarche, what we call early onset of your first menses.
Wow.
And then late menopause.
Wow.
Those are things you can't do anything about.
And then the second one.
And then the ones that you can do something about, your smoking, diet, alcohol, living a sedentary lifestyle, all ties into, you know, there's an association between increased body mass. Okay, so the bigger you are, the more fat you have. It directly is changed into more estrogen production.
Wow.
So excess fat converts to estrogen. So the bigger you are, the more likely your body is able to convert this fat to produce more estrogen. And hence you are more exposed to having breast cancer.
So the fatter you are,
yes,
the more risks
you carry. Yes. And that's something that is within your control. You can control it.
You can control it.
You can diet, you can gym, all those things, physical activity, just to reduce your weight and then reduce your risk.
Wow.
And then another point that I think I should mention here is those who take hormone replacement therapies. So for some people for some reason, maybe when they got their menopause very early, unfortunately some people have early menopause, and so it comes with all the symptoms. And so they decide that to combat the symptoms of the menopause, they go in for hormone replacements. That is, they go back and take the estrogen and progesterone that was reduced, and so to help counteract the effects. And in that case, you are exposed to more estrogen and hence more the likelihood of breast cancer. Contraceptive pills. It's another thing, because all those things are hormones you are introducing into your body. So aside your normal body hormones, you are adding on more hormones. And the worst of them all is those who now take the emergency contraceptives on a daily basis.
On a daily basis?
Some people have made it a habit. So instead of going in for maybe the oral contraceptives, which have lower doses of the hormones, emergency contraceptive is such that it has very high amounts of the hormones. Okay, so, and it's just, as the name suggests, supposed to be for just emergency purposes. But some people have made it a habit. They are not taking the regular oral contraceptive pills, but they now take the emergency contraceptive regularly, because they are always doing the thing that they shouldn't do, and they are always afraid, so they are always chasing it
every day.
Yes, I've had a patient like that.
Was she married or not married?
Not married, mommy.
Not married?
Not married.
So she's always ready?
She's always ready to fight
for any man that
comes.
So
she has multiple in her drawer.
And takes it every day?
She takes it regularly. It's a lot of hormones being introduced into your body. And this is something that you can definitely do something about. And the solution may be as simple as abstinence, or if you are even married and instead of taking emergency contraceptive, you can actually go for a safer option.
That's right.
The contraceptives, there are so many options. There's a progesterone only, that doesn't have estrogen in it. There's the combined oral that has estrogen, which has been associated. But there are other forms, the injectables, which don't have estrogen in them. So you can go for those safer options. There's the IUD that doesn't have anything to do with the hormones. There's a hormonal IUD, but there's another one that doesn't have hormones at all. So you can go in for safer options of contraceptive if you so desire, or if you have a very strong family history. There are safer options that you can go for, which will prevent this exposure to estrogen.
My darling, I hope you are listening. Hey, women, you want children, hey. You don't want children, hey. Early menstruation, hey. Late, oh God, this curse of Eve. But my darling, if you are listening to us today and you are not married, please stop taking what kind of contraceptive?
The emergency contraceptive.
Emergency contraceptive. When we talk about emergency, you don't get emergency every day. My darling, nobody in life gets emergency every day. You get emergency once every 3 months or once a year. If as for you, every day you have an emergency. You need deliverance. I need to take you to Israel, where there's war now, and go through the river Jordan or the Red Sea. No, seriously, you need deliverance. Because then you yourself You are calling sicknesses upon yourself.
Yes.
Please, when the Bible talks about flee fornication, God is a very wise God. He knows it, that the time will come that Dr. Elorm will be talking about estrogen and emergency contraceptive. Please, it is emergency. Emergency. Once a year, you take it once a year. Like I do to my School of Restoration people. I tell them, the drugs, I'm not saying stop, but if you are doing 4 a day, cut it down to 3 a day, and then you go to 2 a day, then you go to 1 a day, then you take half. By the time you realize you've stopped. So it's the same way. If you were taking emergency contraceptive every day, please, let's move it to once a week, and then once a month, and then once every 3 months, and then once every 6 months, and then once a year. Wow. I didn't know there was, I'm old school.
I mean, there's a lot happening. Oh,
There's a lot happening.
There's a lot happening. There's a lot happening.
I became born again too early, so I don't know what is happening in town. Pastor Reverend Chief Apes not bossing me. What he and his wife have been doing, whether they've been taking emergency contraceptive or what. Please take it from Mama Rita. Emergency is not every day. So, Dr. Elorm, let me ask you this question.
Okay.
Now, you've spoken about the risk factors.
Yes.
The first one is
The one you cannot do anything about.
you cannot do anything about, and then the one you can do something
about.
like quitting alcohol, quitting smoking, quitting emergency contraceptive, eating well,
Yeah.
Dieting, gymming, walking at least
Yes.
to reduce a bit. Now the one you can't do anything about.
Yes.
If within the family, somebody ever had breast cancer, or you had your menses very early, 8, 9, or your menopause, you had it very late, so it means that you were menstruating all through. Can you decide, can I just wake up one day and say, listen, this thing about breast cancer and all that, I just want to go and cut off my breasts so that, you know, all these things, wahala will be over? What do you think about it?
Okay.
I know everything has its pros and cons, side effects, and teacher, because I know in the diaspora outside the country, in the European countries, in America, these celebrities who know that there's the history of breast cancer,
Yes.
they don't even wait.
Yes.
They just go remove them and then they are free.
Yes. So there have been, and even before I come to your question, I want to use this platform to actually let people know that if you've had or you have a first degree relative, like I described before, your father, your mother, sister or brother, because we know that breast cancer is not just a woman's thing. If you've had any of such close family relatives at a very early age developing breast cancer, the gene I spoke about, we actually are able to test it.
Oh, wow.
Yes, we are
now in Ghana.
Even in Ghana. It may be at a bit expensive,
okay.
but it's actually possible to test it. So if you realize that your family history is actually very significant for breast cancer, you would do good for yourself to actually, and I think if you weigh the costs and the benefits, it's far more beneficial for you to actually test.
Okay.
And once you test positive for that gene, then you can now talk to your doctor and have that conversation about taking out your breast or taking out your ovaries. Because as you mentioned, there are celebrities elsewhere that once they realized that they had their gene and it was positive, they just went ahead, took out their breast. Some even take out their ovaries as well. So that's because that gene is associated with not just breast cancer, ovarian cancer as well. And even in the men, it's associated with other cancers as well. So they may you can take out your breast, take out your ovaries, and then you know, if you don't have breast, how do you get breast cancer? If you don't have ovaries, how do you get ovarian cancer? So they do that as a preventive measure. That's what some people would decide to do. But even in that case, and but that's a conversation that you should also start with your doctor. Okay, have that conversation, and it's possible, it's being done. So nobody would. It's your decision to do that medically. Once we realize that you have a good reason to have that done, nobody is going to stop you. But the other thing is also, it's possible to be followed up. Once you test positive for that gene, or you have a strong family history, it only means that yes, even if you started your menses very early, or your menopause is ending very late, all we just need to do is for you, instead of waiting till 40 and then starting all the scans, we will start very early for you. So even whilst others are waiting and just doing the breast examination, for you, we'll start even the imaging very early on in life, because we know that you have a significant family history. So you may not necessarily have to make the big decision of taking out your breast or taking out your ovaries, but we can start the early surveillance very early on, so that we can catch anything even at the beginning stage.
Now tell me again about the test. So what's the name of the?
It's called the BRCA.
BRCA.
The gene 1 and 2.
BRCA 1 and 2.
Yes.
So please, if you are writing BRCA 1 and 2, hey, I've written 12, 1 and 2.
Yes.
So that you can walk into any hospital
and then have that test
and have that done, and say, I want to have the test for BRCA 1 and 2, hormone test or just test.
You can just tell them the genetic test.
The genetic test. Please write it down. BRCA 1 and 2 genetic test is very important, please. Dr. Elorm is giving us a lot of information. Please write it down. When Dr. Elorm leaves me, and you send Reverend Chief Ape and I these questions, the kind of answer we'll give you, my darling, don't let us advertise our ignorance once she's here. And whilst this is also going on, please write down your questions. If you have any questions, please write it, and then Dr. Elorm will help us answer these questions. I know you've answered this question already, but I want us to go back to it. How can women in Ghana reduce their risks of breast cancer?
So, Mommy, as I've said already, the things that we can do something about are like your alcohol and smoking. And honestly, alcohol, smoking, any cancer at all, is a risk factor.
Wow.
Alcohol and smoking is one of the things that we can prevent and do a lot about. You can cut your smoking, you can cut your alcohol, and it's mostly a risk factor for any kind of cancer. It doesn't help in any way. So that's something you can do something about. You can do something about your weight. You can do something about your diet. So try and do something about those things. And let's get on top of this breast cancer issue.
Thank you. You have also answered this, but I want you to go again into it. Are there any lifestyle changes? Because some people are not listening. Are there any lifestyle changes that can help prevent or minimize the chances of developing breast cancer? Please, she's answered it, but I want you to listen again and bring changes into your lifestyle.
So yes, again, as I said already, we can take out the alcohol, we can take out the smoking. Those of us Christians, I hope that none of us are indulging in any of those things. But yes, that's something you can do something about. You can decide that you eat healthy and you would reduce your fat intake. So all the fried foods, you can cut them out or minimize them as much as possible. Get more physically active, exercise more. And I'll bring in another aspect that I haven't mentioned before. For those of us who are married, okay, if you can have your children, if you can start having your family early, please do so.
I see.
Some of us are married and we are saying, oh, I want to wait. I want to have my child later. You know, the statistics also, one of the other risk factors for breast cancer is late onset of your childbearing.
Wow.
So your first pregnancy after 30 years increases your chance.
Your first pregnancy?
If your first pregnancy was after 30 years, you are also at risk. So if you are married and God has blessed you, you have everything set for you, and you got married before 25 or 26, just start.
Please tell them for me.
You can just start having it's not easy, but you can do it. People have done it and you can do it as well. Wow. So you can start early. And then another aspect is those who have also, God has blessed you, you've had a child. You have no other problem, but you've decided that you don't want to breastfeed. I beg you, please breastfeed. Because breastfeeding is also a protective factor.
Wow.
Yes.
Breastfeeding. I breastfed all my 4 children.
Mommy, I want to be like you when I grow up.
I know it's not easy.
It's not easy. It's not easy, but yes, it's a good decision. And aside all the other benefits to the child, for you, the mother as well, it actually protects you, because just as when you are doing the exclusive breastfeeding, during that period, your hormone levels are very low.
I see.
Breastfeeding sends a negative feedback to your brain and reduces the amount of estrogen and progesterone that you are producing, so that the hormone that produces the milk is in high levels. So as it's doing that, it's kind of protecting you, the mother, as well, against estrogen exposure. So once that is in place, you are estrogen safe, at least for a period of 6 months or more, whilst you are exclusively breastfeeding. So you have an additional reason to do that.
So what about the husbands who are breastfeeding? Do they also help the wives?
Mommy.
Reverend Eddie has been breastfeeding.
Yeah, so I mean, I've had this question before, whether I've heard this thing where people are asking whether when men suck the breast, is it protective? Well, in itself, even though I would say that men sucking breast has other advantages, not in this case.
Not in this case.
Not in this case.
Please tell Pastor Eddie, Reverend Eddie for me, and Reverend Chief Ape, that's not in this case.
Not in this case. The mother needs to be producing milk and the child needs to be drinking for us to reduce the level of the hormones and then have that advantage of breastfeeding.
When you were talking about the preventive, measures, you didn't touch on the emergency tablets. It means a lot to me.
Yes.
Please tell them what they must do.
Okay, so if you are married and you are looking for, maybe you're not ready to have your child, or you just had your child and you're looking for a measure to prevent pregnancy in the interim, there are other options, particularly if you have a strong family history of breast cancer. You can go for other non-hormonal options. Okay, the contraceptives, they have hormonal and non-hormonal. You can do any of the non-hormonals. However, if the non-hormonals are also unappealing for you, you can decide to do the hormonal, but the one that doesn't contain the estrogen, because they are progesterone only contraceptives. So you can go for that option instead. If that is also unappealing for you, it's better for you to do the combined oral contraceptive, which contains the estrogen. Okay, rather than wait until you have sex and then you are trying to prevent pregnancy, then you go and take the emergency.
Oh, hey, me I'm old school. So the emergency one, they have the sex first and then they take it.
That's why it's an emergency. So it's like unplanned.
No, I thought they take it when they are going to have their sex.
No, so maybe you didn't plan on having the sex, but some people, they know they are going to, and they've already planned ahead of time that I'll take this after. But for most people, it's it's for a situation where you have sex, which is unplanned. Then afterwards, you realize that, oh, you were exposed. So you go in and then you take the medication to prevent the pregnancy.
Dr. Elorm.
Yes, please.
Tell me. So if the tablet is after sex,
yes,
and they are taking it daily, so it means that daily
they are taking high levels of the hormones.
No. Does it mean that daily they are having sex? Oh my God. People need deliverance. And it's not possible you can be having sex daily with the same person. Unless some people, or every day they are changing. Please, come and see me. I will take you through deliverance. Please, talk to them again.
Yes, so please.
I want them to hear this one.
So please, the emergency contraceptives are very dear to my heart, dear to mommy's heart as well. It's only for emergency situations. It's for, if you are, I mean, we are speaking to a Christian audience, and even more. Okay, so if you are not ready to have a child, if you can abstain. If you can't abstain and you've had sex, it's supposed to be emergency. It's not supposed to be something that you take on a daily basis. These emergency contraceptives, they contain higher levels of the hormones than ones you take on a daily basis. Okay, and it's supposed to be so high that if you have gotten pregnant in that short period of time, it can combat or reverse that effect. So the hormone levels in that is very high. So just avoid this as much as you can. It's supposed to be just for emergency situations. Okay, thank you.
Dr. Elorm, when the thing is getting nicer, that's when you realize that time has gone. My darling, I know you're also enjoying it as much as I am in the studio. At one point, I hope the camera wasn't on me. I had opened my mouth. The emergency contraceptive, the daily one. I mean, I had literally opened my mouth. It's getting interesting, but unfortunately, we need to close the curtain for the day. But I know how busy Dr. Elorm is. What we'll do is we will close for the night, but I will keep her here because I have a lot of questions to ask her. I mean, I came really prepared with my questions. So she will stay on. I don't know if I'll get her next week. So she will stay on. I would ask her my questions so that in case next week I don't get her, I've asked her all the questions. But please do send in your questions. Whatever questions you have, send them in. Even if I'm not able to answer the questions today or next week, I don't know, we will let her come back and she's going to answer all the questions for us. But Dr. Elorm, you are such an intelligent woman.
Thank you, Mom.
You don't have a notebook and you have things just coming like this.
Thank you.
You didn't go through the school. The school went through you. Medical school went through you. You are very intelligent. Your husband is blessed to have a wife like you.
Thank you, Mommy.
Thank you for coming.
Thank you for
I know you've
having
left
me.
your baby. I know tomorrow you are going to work. But please, you will stay another 45 minutes. I will even say 1 hour to scare you. You will stay another 45 minutes so we can finish off all the questions I have for next week. So thank you so much. This is Pink October, Pink Month. Please, Breast Cancer Awareness Month. Take advantage of October. Go and do a check. Listen to me, listen to Dr. Elorm, and then all the other doctors or medical practitioners who will come. Please listen to them. Let's prevent breast cancer. And then when I am done, they will show the breast cancer, the child cancer project again. Please support us, help us. Nothing is too small, nothing is too big, so that we can deliver a child who has cancer. We can save a child who has cancer. We can bring healing to a child who has cancer. We can bring a smile to the face of a child. Thank you so much. Same day, same time, make a date with me, Family Life with Mama Rita. And you can see the family life is so broad. I don't know if we can ever finish family life, because family life is not just sex, it's not just marriage, it goes beyond it. Anything about the human being has to do with family life. I love you. I'll see you same day, same time next week. God bless you.
Childhood cancers is no fault of the child, and it can happen to any family at all.
Shani Yarban into a month to Monco school. It's doctors for Nankasa and our funk or fire or back as well hostel.
And this year also we JHS. By his son say only any treatment in Tino on Timinko school. Nayale we bawa kwen so we busu ya phone feel bi. You see I ko jam ne papa pe. O bi oni bi ono na be friend. So we nya ma wa na wo ho.
Every year, it's expected that we have about 1,003 children diagnosed with childhood cancer in Ghana. However, we see just a third of them, about 500 children diagnosed with childhood cancer in Korle-Bu alone. And this shows the gravity of the situation. Childhood cancer, number one, is curable. In developed countries, majority of the children, if you take 10 children, 8 out of them receive cure and they live fulfilling lives. But the same story is not the same in Ghana, where 4 to 6 children would be saved because of, number one, ignorance of the early warning signs, and number two, the financial constraints associated with treatment of childhood cancer.
Mbeni yelbeze esha sinize na dakope menyene da na mude obi a wenya code ti mu adechi na mhwe na moje fini winuma or bana mazino ko hospital kipus intabet ti mukwe woman edra mu moje ni nyina ajai ti doctor mbisa doctor and then tabada na waye na me moje ojai no so adibi abon hono wo ni hwene mdos do ahaz muntu mun kan yarba na nchone mama akọ Korle-Bu ti ampa so 2021 numun na ye banti ya ben so nkaka na doctor nkechem do cancer na endu na botande ne bo yaji na me na me amutan ezmi ya dan mba kenya cancer December or ben wenya 4 years this why operation first one second one. The doctor is there, but I can't be medrun sha. What's the man and every now what should be a mutu 5,000 and one for baby amba.
Treatment of childhood cancer is not easy, and it may involve different kinds of treatments. It may involve chemotherapy, which is the medications that we give, or it may involve surgery or even radiotherapy. And all these treatments are cost intensive, and unfortunately, nobody prepares for cancer, so nobody stores up money to treat a childhood cancer. So it creates a huge toll on the family. Some parents lose their jobs because the treatment of cancer, unlike treatment of malaria where within 3 days you are home, treatment of cancer can range between 6 months to 2 years in and out of the hospital. And this puts a strain on the child's school and puts a strain on the family's finances. And it's important that we support children with cancer in every way that we can.
Pacho me bana yare na shasia o tipaye. Starting on eti na se wani nsuo free na sumo ba. Nti me de ne ko hospital no mo se ye kaka. Ye ya fe na mo nka hwenche na ye de ne ba St. Dominic akotia. Ti ye ko ho no nso etwa be se 6 months e wo. Enye easy. Sika se nko a. Ti doctor ba ko na refer ye ba Korle-Bu. Nti me ba hanom se na enema ti sika even lab no kra before so be ye dra be lab to de bia unya sika every 3 weeks bia me ba ne to edru almost 3,000 ho labs obeye ansa edu we bia doctors for na so asen a nti mi njina no isi ame wa ma wa 1 year me nko fie yale a chini pa ba akofo a ama wa kafa konti scan ni ho se isi ame wa ise me date so na ye dro ma me ha mu baby amekọ akofo ska even radiotherapy e de me ba ne ko to so no 15,500 ye started 13 days no ena omo yi ni free so say mentimi ave ska na mentino yentimi nto asubiem nti se ama me ba no ni ba akopese enkata
ebia me sister penny ba pe na kadam ye wo school chenwa na mere aho efise me ye man kame sunu wo school sibe pesa man fo be boaye na yenye skane ebi motimi di tomondro then machine so ma montimi ko amuko me pesa be ye pastries honiema decorations to say wedding decorations and cakes and I'm pesa me.
As part of our 30th anniversary, we are going to make a donation to the pediatric oncology unit. What do we see in the pediatric oncology? Children with cancer, various forms of cancer. Most of the mothers that come in do not have money to even purchase their medications. Some of the children get diagnosed whilst they are in school or writing exams. Their parents find it very difficult for them to go through all the stages of chemotherapy or even radiotherapy. Apart from leukemia, which is one of the commonest, we have lymphomas and even kidney or renal tumor. Some of these children need to have surgery before they have their chemotherapy. And in this situation, when we are working in such a facility and there's no money to help them, donations from the church is what can push or support these kids. So even as you are going to give and support this very big project, which is on the heart of Mama Rita, remember that it's going to put a smile on a child's face. It's going to help a child finish school. It's going to make a parent very happy and also reduce childhood mortality altogether.
Our giving will actually go a very long way to help these children who are suffering with cancers.
Mrs. Ale masitine mu de me hu se maka echi bebre abrabom fi se me hwe bebia na me wo na me nibi ba bebia me du ya yale we ya ma sa ba from no de me nim time ametimi asa peja abedu sa bebia na me wo no nanso ni na mi de nyame asese me ti ase impo me ba no bebia na owo ende if it's a son of the backlibu, and yen and na oddity. Until the Yamiasi, and it does all say be a dachi. The master message. Intimate say, or be biarek, or what's my yow. One chan any measure colibu, and collect children's blood, and ye easy my.
The minimum cost of treatment for 6 months for one child costs 10,000 Ghana cedis. Imagine the difference you can make. Matthew 25 verse 44 through to 45 says, Master, what are you talking about? When did we ever see you hungry or thirsty or homeless or shivering or sick or in prison and didn't help? He will answer them, I'm telling the solemn truth. Whenever you fail to do one of these to someone who has been overlooked or ignored, that was me. You failed to do it to me. Join us in this mission. Give what you can. Together, we can make a difference and touch our generation with the power of God.